Good morning, students. Welcome to today's lecture on dengue fever. Dengue fever is otherwise known as break-bone fever, is a viral infection. It spreads from the bites of female Aedes mosquitoes to people. More common in tropical and subtropical climates. Most people who get dengue fever won't have any symptoms. The most common symptoms are the following: high fever, headache, body aches, nausea, and rashes. In severe cases, dengue fever can be fatal also, can lead to complications such as dengue hemorrhagic fever or dengue shock syndrome. Lower your risk of dengue fever by avoiding mosquito bites, especially during the daytime. Now we can go through the symptoms. Most people have mild or no symptoms and will get better in 1 to 2 weeks. But rarely, dengue fever can be severe and can lead to death also. Symptoms usually begin 4 to 10 days after infection and last for 2 to 7 days. The most common symptoms are the following: high fever, around 40 degrees Celsius or 104 degree Fahrenheit temperature. Severe headache, pain behind the eyes, muscle and joint pains, nausea, vomiting, swollen lymph nodes, and rashes. These are the common symptoms. Symptoms of severe dengue. Who are infected for the second time are at greater risk of severe dengue. Now we can go through what are the symptoms of severe dengue. Severe dengue symptoms often come after the fever has gone away. Those include severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums or nose, fatigue, restlessness, blood in vomit or stools, being very thirsty, pale and cold skin, and weakness. Please keep in mind, bleeding manifestations are the most common clinical manifestations of severe dengue. Bleeding from gums and nose, or bleeding in gastrointestinal tract that can result in blood in vomit or stools. People with these severe symptoms should get hospital care right away. Now we can go through the laboratory tests for dengue fever. Okay, complete blood count is the first investigation to be done. Look for thrombocytopenia or low platelet count and hemoconcentration, that is elevated hematocrit values. NS1 antigen test, that is a non-structural protein, that is NS1 antigen is specific for dengue. Dengue virus NS1 antigen in the blood provides early confirmation of dengue fever during the initial days of fever. IgM and IgG antibody tests using ELISA, that is enzyme-linked immunosorbent assays for dengue-specific IgM and IgG antibodies, can help to confirm the diagnosis. IgM antibodies are detectable a few days after the onset of symptoms in the acute phase. Okay, IgM is the first antibody to be positive. appears on day 3 to 5 of illness in case of primary dengue infection. Primary dengue infection means dengue infection occurring in a person who never had dengue before and persists for 2 to 3 months. So IgM appears 3 to 5 days of illness in case of primary dengue and persists for 2 to 3 months. IgG antibodies appear later. Okay, may be present later. It indicates dengue infection in the past. IgG antibody alone that shows dengue infection in the past. IgG appears on the 14th day and persists for lifetime for primary infection. In case of secondary infection, how we can identify for secondary infection, IgG raises within 1 to 2 days after onset of symptoms, simultaneously with the IgM antibodies. So IgG will be present. That shows secondary infection. But IgG rises within 1 to 2 days after onset of symptoms, simultaneously with the IgM antibodies. Okay, that shows both IgG and IgM are present. That shows secondary infection. Now we can go through the treatment. Most cases can be treated at home with paracetamol, rest, and hydration. I told you before that most of the cases will have mild symptoms or no symptoms, right? They can be treated at home with paracetamol, rest, and hydration. Please avoid non-steroidal anti-inflammatory drugs like ibuprofen and aspirin. Okay, why? Ibuprofen, aspirin, and other non-steroidal anti-inflammatory drugs can increase the risk of bleeding. There is no specific antiviral treatment for dengue, but symptomatic treatment is very important. Okay. Supportive treatment at home is very important. Supportive treatment is symptomatic treatment. For people with severe dengue, such as dengue hemorrhagic fever or dengue shock syndrome, okay, hospitalization is needed. Okay, now we can go through various supportive treatment to be given at home. Supportive measures that can be taken for mild cases of dengue fever at home are as follows. Rest helps your body recover. Stay hydrated. Drink enough amount of fluids to prevent hydration. What type of fluids we can be administered? Okay. Water, oral rehydration solution (ORS) is available in pharmacies. Clear soups, coconut water, all can help maintain fluid balance. Pain and fever relief using paracetamol or acetaminophen that is available over the counter. Okay, pain relievers and anti-inflammatory drugs such as paracetamol, Panadol to help reduce fever and alleviate pain. Okay, please keep in mind patient need to avoid aspirin and other non-steroidal anti-inflammatory drugs like ibuprofen. Okay, as they can increase the risk of bleeding. Okay, because bleeding manifestations can be a complication of dengue fever. So we should avoid those drugs which can induce bleeding. Diet. Please administer light and easily digestible foods like rice, steamed rice, boiled rice. Okay, then the millets and other uh, pulses can be given. Chicken and fish can be administered, easily digestible. Avoid fatty foods like red meat, high fat diet, fried food. Okay. Avoid spicy foods. Frequent monitoring is very important. Huh? Monitoring of uh, uh, clinical signs like temperature, blood pressure, and symptoms. Okay. Severe or worsening of symptoms, seek immediate medical care or hospitalized care. Use mosquito nets, okay, to prevent spread of virus to other mosquitoes, thus preventing the transmission cycle. Isolation of patients under mosquito nets or insecticide treated mosquito nets to prevent mosquito bites, as infected mosquitoes can transmit the virus and infection to others susceptible to infection. Insect repellent on exposed skin and clothing to prevent further mosquito bites. Choose a repellent that contains diethyl DEET, diethyl or other recommended insect repellents in the country. Supportive care at home is only suitable for mild cases of dengue fever. For severe symptoms such as bleeding, severe abdominal pain, persistent vomiting, the signs of shock. Signs of shock means giddiness, loss of consciousness. Shock means it reduction in blood pressure levels. Okay, patient may feel giddy, patient may feel unconscious, may faint, fainting attacks will be there. It is essential to seek immediate hospital care. Dengue hemorrhagic fever and dengue shock syndrome can be life threatening and require specialized medical care, including IV fluids, sometimes blood transfusion, sometimes plasma transfusion in a hospitalized setting. Okay, now we can go through the treatment for dengue at a hospital setting. Treatment in a hospital setting is essential for severe dengue, dengue hemorrhagic fever, and dengue shock syndrome. First step is monitoring. Okay, close monitoring for vital signs. Okay, including blood pressure, heart rate, temperature, respiratory rate, oxygen saturation. All these things are monitored. Assess platelet counts, hematocrit values, and liver function. Then, intravenous fluids are administered to maintain blood volume and blood pressure because plasma leakage will be there, right? So, uh, uh, intravenous fluids will be um, um, leaking out because of plasma leakage. So, blood volume and the blood pressure is maintained by intravenous administration of intravenous fluids. Blood transfusion. In cases of severe bleeding and dangerously low platelet counts, blood component transfusions may be required, help to improve clotting function of the patient. Okay. Then pain and fever management using paracetamol or acetaminophen to manage high fever and severe pain. I told you before, myalgia will be there, severe pain of muscles and joint pain will be there. Um, Retroorbital pain may be there. Retroorbital pain means pain behind the eyeballs. Okay, headache will be there. So acetaminophen or paracetamol is given. NSAIDs like non-steroidal anti-inflammatory drugs such as ibuprofen and aspirin should be avoided. So, because they are having increased risk of bleeding manifestations. Respiratory support is given if needed. If the patient experiences respiratory distress, oxygen therapy is given. In severe cases, even mechanical ventilation may be needed. Isolation of patients. Patients with dengue are isolated in a mosquito-free environment to prevent the spread of virus to other mosquitoes. And through that, it will be spread to other susceptible people, which could potentially transmit infection to other individuals. Treatment of complications. Okay, sometimes complications can be liver damage, kidney dysfunction. Okay, in those cases, additional medical interventions may be necessary. Referral to gastroenterology department or to uh, nephrology department may be required. Okay, to take care of liver dysfunction or kidney dysfunction. Close monitoring for shock. I told you in dengue hemorrhagic fever and dengue shock syndrome, patient may develop hypotension and a shock. Okay, the patient's condition is will be should be closely monitored for the development of shock. That is the reason that dengue, severe dengue patients should be hospitalized so that they can be monitored, close monitoring for shock and other complications can be done. Early detection and management of shock are critical in dengue fever. Transfusion support. Patients may require repeated blood transfusion, blood component transfusion, like a plasma transfusion. Okay, frozen plasma should be transfused. If bleeding continues or platelet counts do not improve, frequent assessment, regular assessment, and clinical evaluations to track the progress of the patient and patient's response to treatment. Okay. Early and appropriate medical care significantly improves the chances of a successful recovery in severe dengue cases. Those with the severe symptoms such as bleeding, rashes, and bleeding manifestations, vomiting, okay, with a blood in vomitus, blood in stools, abdominal pain, persistent vomiting, shock, okay, seek immediate hospitalization. Dengue hemorrhagic fever and dengue shock syndrome are medical emergencies that require specialized care in a hospital. Hope this session was useful for you. Thank you.